Good morning. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you a little bit about retention. And when you get a case that's a deep bite, it's best always to put some type of upper retention in there. If you make it with a regular retainer and the person loses the retainer or leaves it out for a week or two, then the bite will deepen more. And they put the retainer back in, then all the pressure is on the front teeth and the condyles up here, and it begins to hurt. And so they think something's wrong with the retainer. So if you've got a deep bite case where the lower teeth close way up in the behind the upper teeth, and you do this, they will always try to deepen again if you leave the retainer out. You have to wear it for years before it'll stop trying to do that. So this case right here is that way, and I put a upper bonded retainer, and I'm sorry that I didn't use more of these upper bonded retainers throughout the years on the cases. Here's a nice young lady. We won't take much time looking at it. The facial structure, everything's fine. And this is after we've finished the case. But here are the models on the case, and you can see this is a genuine deep bite. I mean, the upper anterior teeth are just virtually cover over the lower anterior teeth, and consequently, when you get through with this case, it's going to try to deepen again. It's just because when you open it up, you have to push these teeth down and these teeth up, and you use the molar teeth to do that. And so to get the force to push these teeth down, it's going to pick these teeth up a little bit, but then they chew against each other, and it's not a great deal, but it is some. And so that's what happens when you repair a deep bite case. Invariably, you're going to open the bite a little bit, but not all that much. But it'll try to deepen back again. Now, when you look at the side, we've got other things to do here with the case. We're waiting on a tooth to come in here, and we'll have to level it up and do all the regular orthodontic things. And so we won't, we won't talk about them much. We're just going to talk about the retention of it. So this side, same way, nearly class 1, if you bring it out. Now, in this particular view, you can't see from the digital part, but you can see of the models. I mean, the lower anterior teeth are right up against the roof of the mouth. And when you lower this down and raise this up, and that's exactly what we do, but the force comes from back here. So to push this down, this has to go up some, or it puts pressure on it to go up. If the person chews real good, there's very little elevation or movement of these teeth. Now, if it's a real deep bite and you don't want to open it one absolutely bit, you bond some blocks back here with these back teeth, and they'll bite on those, and you can level a deep bite case without elevating it hardly any at all. But to be sure that it stays that way, it'd be best if you have upper retention in it. So let me get on here with the case, and that's the way it looked when we started out. And the lower anterior teeth can be deep. If you have a class 2 case, they can deepen and they won't be crowded. If it's class 1, they have to crowd up. This is close to class 1, so we got some crowding in this area right here. So then the uppers are going to have to be expanded out too to enlarge that enough to get those teeth in. We don't want to change the facial structure. Now here the case is finished. or virtually finished. I'm going to show you the bonded upper retainer that we put on here. This is in a class 1 case now, and the overjet and overbite is correct. In other words, these teeth are setting a little bit over, so when they go to bite a sandwich off, bite the front teeth together, the back teeth should not hit. And that's why you have a little overjet like this, and you go forward, then your back teeth don't hit, and you bite down. And when you bite up in this area, you're going to put a load here and then a load on the joint. And that's why you can't bite hard when you bring your jaw forward and bite. You're just, nothing is supported in the back part of the mouth, and the pressure goes on the joints and on the teeth. So you can't really bite something real hard out here unless it's a dire emergency or something like that. You could bite down even though you put excessive pressure on the jaw joints when you bite forward. But if you're end-to-end bite, you're just always biting on those teeth, but you can't bite your front teeth together without your back teeth hitting. So this gets a little complicated. And when you chew to the side, you shouldn't hit on the other side. Simply the condyle drops as you go to one side, and it drops over here, and that separates the teeth back in here, and that's the way it should be. I didn't start out to do a video on occlusion and everything like that, but this just show you I want to keep this the distance between the teeth. I don't want this to bite I don't want the bite to close back again. All right, so we come back on the bottom. On the top arch, we finish the bottom up and everything, and we bond a little 3 to 3. Really, I'd rather have it go all the way back to the molar if you can. The cuspid, and let's bond that you want to be able to close all the way to and just have your teeth print in these areas up here. Don't put it too high. You close together and make sure you got it low enough. Then you put your bonding material on here, or you put some on a couple of teeth. You bite two and then put the other. While it's soft, you bite together again. And then it's got to be just on the teeth. You don't want the bonding material in between the teeth so the person can clean their teeth with dental floss, you see. So you bond it like that. Now let me erase that, and we come back in and build your retainer and have it come over that with just a thin bit of acrylic up there. Now if the person loses the retainer or takes it out for a week or two or something like that, the bite will try to deepen, but the lower anterior teeth have a shelf that they're biting on right here, and they don't deepen. Now the retainer up above is necessary in that you've expanded this case to treat it and make it look nice, and so you've expanded it out past what the inner pressure is on the teeth. And whenever you expand the case, you've got a long-term retention because you've increased the pressure out here and decreased the pressure in where the tongue is. Now, over a period of time, the tongue will get spread out in there, and the pressure on the outside will go back if you hold it in place for a great long time. In other words, in deep bite cases, you've got to retain them much longer than you do just a normal bite case. And if they lose a retainer, you've got a mess because they think the retainer has gone wrong where it hadn't. So it's good to put this in there. Now we'll build the retainer, and I should have run this wire back to the cuspids to make it work right. And now the retainer covers over the wire. So if you're wearing this retainer because you've expanded this arch, you've got them out further than they were when you started. And so it'll tend to close down some, even though it can't deepen up here. So you wear the retainer to get the retention out in this area. And also you've got just a thin layer over that bonded retainer up above. But you take the retainer out and it'll go down over it, but you don't lower it enough to where when you put it back, it starts to hurting the joints back here. So I strongly recommend putting bonded upper retainers in along with bonded lower retainers on any deep bite case you do. And I'll have to admit that I have not used this as much as I should have. And so this is the best way to, so that, in other words, we've crowned some cases and had a little shelf back here, and the teeth fit in that, so the case couldn't go down. I think we did that on the guy that chewed so hard and ground his teeth off. All right, so here we'll show this on X-ray. We started this case, and you can see we're this much, have that much deep bite on this old Panorex that I had. It goes down, and this was the first Panorex we've taken. She's 12 years old, and she's still got some teeth to come in. And here now she's 13 years and 1 month, and this baby's tooth is gone, this roller. So we're kind of waiting on this to come in before we finish, and she's got wisdom teeth, and you can see all the way around. We left the wisdom teeth alone. Now let's watch. This will come in, and now we bond the lower retainer. We fix that up, and then we come back again and bond the, this is bonded with the upper retainer is in here too, and you can see both of them fitting. So I'm recommending that you put your upper bonded retainers in on every deep bite case. It'll make it where if they lose their retainer, you don't get messed up again. And in this case, you can watch these wisdom teeth, and if they've got nearly room enough, and when they get in, we just leave them alone. Or if they start getting into trouble, we'll have to remove them if the teeth in front are in good shape. So I hope you get something from this, and I'm going to close it up now and stop the case.